Hey everybody, welcome for the first official live Q&A. I hope everybody is doing well. I'm going to give everybody a few minutes to jump on. And so we're going to get going and start answering some questions. I'm super excited. We got a lot of great questions on Facebook, and hopefully we are going to answer some of your questions about cancer in dogs and cats. So if you're coming on, tell me who's here and maybe where you're from, and I'm going to wait a few more minutes while everybody gets going. And let's see if I can figure out the comment section. I see that Dan has hopped on. Hey Dan, how are you? Let's see if we're going to get the comment section going here as well. So just while people are hopping on, I'll let you know that I am super excited. I'm at my new hospital. Hey, Kara. Oh, with Eclipse. Hi, Eclipse, one of my brand new patients. So I am currently at a new job, super excited. I am working for a great hospital, a great company called Compassion First, and I am at the Veterinary Cancer Center in Norwalk, Connecticut. So luckily, I did not have to move. Personally, my family is still in the same place, but I did move hospitals. And so I left the Hudson Valley area, and now I'm closer to New York City. So again, I'm in Norwalk, Connecticut. Hey, Caitlin, welcome. Phelan's mom's here too. So some of my friends are here. That's great. My support system always makes me happy. So you can see this is my exam room. Look how beautiful. I'm in a beautiful hospital. Tomorrow I'll be sharing a vlog post with a little tour of the Veterinary Cancer Center. So you can definitely check that out tomorrow and see this beautiful place. I always tell people you don't want to meet me at work, but if your pet has cancer, I'd be happy to meet you all in person. Okay, so I have a list of questions from Facebook yesterday, so I kind of printed them out, so I'm going to try to hit as many as I can. And hey, Paula, and if we don't get to them, we'll just have to hop on and do this again, and feel free to let me know if you have additional questions. I'll try to keep checking the comment section, and you know, if you have any other questions, just feel free to put stuff in the comments. But here we go. So I'm going to start with the first question, which is definitely something I feel pretty passionate about. And this was sent in by Ida McBride, and said, I found a small hard lump, this pea-sized lump on my 8-year-old Labrador sternum. So I brought her to my vet yesterday. She said she felt it and wasn't bothering Ruby in any way and seemed quite fixed. She said it could be lumpy, and we have two options: either do a needle aspirate or send it in for testing, or keep an eye on it. And Ruby's mom chose to go for option number 2, so that we keep an eye on it approach. So I feel really strongly about this one, and this is, you know, why I started my program called See Something, Do Something, Why Wait, Aspirate. And the problem is you can't look at a mass, we can't feel a mass and know what it is. And it could definitely be a benign lipoma. We know about 60 to 80% of lumps and bumps in dogs and cats are benign. So if you're a gambling person, it's most likely benign, but 20 to 40% are malignant. And this is the perfect size. So the point of the program, if the mass is the size of a pea, which is 1 centimeter, the same size as an M&M or a Skittle, we want to go to our veterinarians and we want to do those aspirates. Because if it's malignant and it's the size of a pea, and you know, we could potentially cure this dog with a simple surgery, find out what it is before we remove it, so we can make sure that surgery is the only surgery that the pet needs. So if we don't know what it is and we just lop it off and it turns out to be something malignant like a mast cell tumor or maybe a soft tissue sarcoma, Ruby's going to need to go back and get a second surgery. So we want to stick that needle in it, find out what it is, and then if it's benign, your vet can make recommendations. But if it's malignant, we definitely want to get that tumor off sooner rather than later. So I definitely don't recommend keeping an eye on it. And also, you know, I just had this very same experience with my own Labrador. So we want to stick needles in it and find out what they are. So that is my answer for Ruby, the Labrador with the lump and bump. Definitely, why wait, aspirate. Let's go stick a needle in it and find out what it is. Hopefully we'll be benign and we will have a happy ending. So let's see, we're going to kind of go through some of the other questions. We're going to continue. Does that make sense, everybody? Was that good? Anybody? Anybody still there? I'll look for some comments. So we see that Magnificents are on. Hey, welcome. I see Paula's on. Oh, there's two Paulas on back to back. So again, that is the answer for the first question about what to do with lumps and bumps in our dogs and cats. Definitely go to your vet and get them aspirated. Thanks, Caitlin. Somebody's paying attention. Somebody else might be checking their Facebook feed. Okay, so let's go on to the next question. So we have another question about lumps and bumps. So Andrea says, after having 2 mast cell tumors removed, does a dog need to stay on Benadryl and Prilosec or Tagamet? I've seen conflicting information on this. Both of the tumors were low grade and removed completely. So they got that normal rim of tissue around it. So they got margins. One did have close margins. So in general, well, let's ask the first question. Why would we have a dog with mast cell tumors on Benadryl and something like Prilosec, which is omeprazole? And so the mast cell tumors, inside the tumor, there are little granules that contain histamine. What's histamine? Histamine is the stuff that makes your nose run if you have allergies. So it's an inflammatory substance. And the cancer cells contain histamine, and they can release it, and that's why mast cell tumors are notorious for kind of getting bigger and then shrinking. And people say, oh, well, it can't be a tumor because it shrunk. It's not because the tumor shrunk, it's because it released some histamine, it had some local inflammation, and then the histamine gets absorbed, and then the inflammation goes away. The concern with dogs with mast cell tumors is they can have circulating histamine, so we keep them on Benadryl, and then the Prilosec or sometimes famotidine is an antacid because that histamines can increase our stomach acidity and make us have an upset stomach. So it's not a bad idea for dogs with mast cell tumors before surgery to be on those medications. In my opinion, if they've been removed with margins, Andrea's dog does not need to stay on Pepcid and Benadryl. If a dog has metastatic mast cell tumors or mast cell tumors that can't be removed, so the dog has a big mast cell tumor on its side, then definitely for sure we would want to keep them on Benadryl and Prilosec, again, which is omeprazole or something of that nature. But in general, once the mast cell tumor or tumors have been completely removed, even with close margins, I wouldn't recommend that they stay on that. In terms of the closed margins, probably something to discuss with your veterinarian or an oncologist as to whether or not that dog can have a second surgery. So scar revision to go and clean up the tissue around the scar to prevent it from coming back. But to answer the question about Benadryl and omeprazole, I don't think that the dog needs to be on it. And again, just to kind of put it out there, these are general recommendations. I obviously can't make specific recommendations for a dog or cat that I haven't seen, but just to kind of answer some general information about some of the things that we see with some of our pets with cancer. What about using golden paste if it cannot be removed? I'm not aware of what golden paste is, so I can't answer that specific one. All right, so how are we doing? We're doing well, everybody? Yes, Paula, why wait? Aspirate for sure. I see that Steve just joined. Hey, Steve, how are you? So thanks, guys, for joining on. So lots of questions. We'll keep going, right? We're doing pretty good. We've only been on for a couple of minutes, and we've got 2 questions done. Okay, Dawn Marie wants to know, are supplements for mobility like glucosamine, chondroitin, MSM, yucca, vitamin C okay to give during chemotherapy? So in general, yes. Obviously, you want to talk to your veterinarian or your oncologist about that, but I usually do keep my patients, because a lot of our patients are middle-aged and older, right? And so a lot of them will have pre-existing arthritis, and they really, it's important that we're keeping our pets comfortable, because I've had, some lymphoma patients where the cancer is in remission, tolerating chemo like a champ, but their arthritis was really so bad that they, were having problems getting up in the morning, getting in and out of the car, going on walks. So as strongly as I feel about treating pets for cancer, I feel, making sure their other health conditions are covered, including arthritis, is really, really important. So in general, it's totally fine to keep them on glucosamine. I have Matilda on another one of them that is escaping me at the moment, but she loves that. And so, yes, it's definitely important that they're on their supplements for mobility. One of the ones that does jump out at me is vitamin C, which is an antioxidant. And so really talk to your oncologist or your veterinarian specifically, because some chemo drugs are a little bit different. So doxorubicin, which is a very common chemotherapy that we use for, it's in the lymphoma protocols, could be used for some carcinomas, some of the sarcomas as well. One of the ways that the chemo drug kills cancer cells is free radicals. And so if you put a pet on a vitamin or something that's an antioxidant, it could negate some of the effectiveness of the chemotherapy. So that's the only one that jumps out at me. But in general, the chondroitins, the glucosamines, and everything like that are fine for your pet to be on during chemotherapy. And then, of course, you know, just check with your veterinarian or your oncologist. And the vitamin B's, in general, no problem as well. So B12 supplementation is often one that I have some of my patients, especially commonly cats with lymphoma, often have low B12 levels, which is cobalamin. So in general, B12 levels B12 shouldn't be an issue. It's really the anything that's an antioxidant. So vitamin C is an antioxidant. So that's the one that I usually worry about. And so sometimes if we're not sure, we'll have them stop the supplements, certain supplements that are antioxidants, usually a week before their doxorubicin, and then not restart it for a week after. So again, definitely ask your vet about that as well. Is that good? Is that helpful? All right, can I use a back brace in my child? That has been, so there was just a question that came up about a back brace with intervertebral disc disease, and I'm going to say that I'm not sure. I mean, it would seem fine, but I don't manage disc disease, so I'd probably talk to your veterinarian about that, and I'm not sure if we're talking about a dog with cancer. Multivitamin in general should be fine, again, Paula, but again, you know, we just need to think about anything that can be an antioxidant, and is your dog on doxorubicin. That's the main one that really we require. The free radicals is one of the mechanisms that the chemotherapy will help kill the cancer cells. So those are really the ones that we're thinking about. Okay, what else have we got? So let's move on to some kitty questions. I actually got a good number of questions on cats, and one of my nurses at my previous hospital always felt that cats were sort of second-class citizens in the world of cancer treatment. One, I have to tell you, I see less cats. I do think that there's probably less cancer in cats, but there's also often less information about some of their cancers as well. We have a good amount of information about lymphoma, but some of the other cancers we have less information. So Vicky asked, what are the most common occurring feline cancers, general prognosis, relative length of treatments? And so that, I think I had emailed back and said, well, that's a really big question for our live Q&A. But, you know, what specifically, and if I remember correctly, she had responded that, you know, just kind of wanted to know what to look out for in her pet. And so that's a great question. And so one of the things that I think is really important, so, you know, with cancer is early detection. And that's the point of the lumps and bumps program, is finding those lumps and bumps early. But there are a lot of internal cancers in our dogs and cats as well. And it's really hard to find them, right? And it's really hard to know if they're off for a couple of days, if they're quiet, maybe why they're not feeling well. So one of the things that I think is really important is routine visits to your veterinarian. And as our pets become middle-aged, people say, well, how often do I need to go to the vet? And I really think twice a year. And some people are going to say, wow, twice a year, that seems kind of often. But think about how dogs and cats age. And so, you know, they say in dogs that 1 year is worth 5 to 7 years. So going to the vet twice a year once they hit middle age is really not that often. It's every couple of years for you or me. So I really do think one of the things that we can do for finding cancer earlier in our pets is routine health care, having your vet do a good physical from nose to tail, routine blood work, and often things like chest x-rays and ultrasound to look for those internal cancers that we might not otherwise see. So some of the common cancers that we see in cats are gastrointestinal lymphoma. We see lymphoma elsewhere, but gastrointestinal is definitely the more common one. And there's two subtypes. There's a very rapidly progressing one, high-grade lymphomas, and then the low-grade ones, which often mimic inflammatory bowel disease. So the symptoms can be things like vomiting, diarrhea, weight loss, and poor appetite. And the problem with a lot of symptoms in dogs and cats with cancer is they're not specific. You're not going to call your vet or post it here, and I'm going to say, oh, you know, that's definitely cancer. So they're often very non-specific, so we have to put the pieces of the puzzle together. So again, that's why I think it's really important to go to your vet. And I'll be honest, my own cat lost a lot of weight before he was diagnosed with inflammatory bowel disease, because it's hard when we're with our pets day in and day out to always know, you know, that they're losing weight. So gastrointestinal cancer, monitoring our pets for their weight and those symptoms are important. Some other common cancers that we see in cats are mammary cancer or breast cancer. As you guys can hear, I'm in my clinic, so you may be hearing the dog in the waiting room barking behind me. Mammary cancer, and again, this goes back to feeling our dogs and cats, you know, every month for lumps and bumps. So mammary cancer in cats is similar in women in that it's very, very aggressive, and 85% of breast cancer in cats is malignant. In dogs, it's about a 50-50 split, so half are benign and half are malignant. So that would be another one. And then, you know, other cancers that I think are really important to think about in cats or an area that I think is really hard for us as pet owners to evaluate is oral cancers. And this goes for dogs as well. And so one of my least favorite cancers in cats is squamous cell carcinoma, because it's very usually advanced by the time we find it. And so it's really important that we're getting our cats in and that they're getting their mouth looked at, and, you know, so really opening that mouth. And some dogs and cats actually require a sedated exam to look in their mouth. If your dog or cat's getting a dentistry, that's a great time for the doctor and the nurse, when they're intubating them for anesthesia, to look in that mouth. And that's often the time that a lot of my patients ended up getting mouth cancer diagnosed, was at that dentistry. So again, that's going to be another good time for us to be looking for cancer. So those are some common cancers. You know, the skin cancers are also common. Some of the ones that are benign in dogs are malignant in cats, and vice versa. We don't see as many benign lipomas in cats, but they definitely can still also have malignant cancers as well. So again, feeling our pets monthly for lumps and bumps is going to be a good way to find cancer early. Oh, look at that. The next question from Sasha was about squamous cell carcinoma inside the cat mouth, and wanted to know what the options were. And I kind of alluded to this. I hate squamous cell carcinoma in the mouth of cats. And dogs are totally different, but it often does not have a lot of great treatment options unless we find it small. Ideally, the best treatment option would be to do surgery. And in general, if you think about the dog and the cat mouth, the lower jaw towards the front is going to be the easiest part to do surgery, just the anatomy there. But the top part of their jaw bones, the maxilla bones, are connected to the nasal bone, so that can make it hard. And a lot of these tumors are associated with the tongue and often under the tongue. So studies have not seen a lot of positive impact with surgery, radiation, or chemo. And we often really need to focus on supportive care for these kitties. What do I mean by that? Pain management, so pain medications, and nutritional support. A lot of these cats don't want to eat, and so a lot of the times we actually have to put in a feeding tube. And I know when I say feeding tube, do you guys think good thoughts? No, right? Because in people, we think of feeding tubes in patients that are very sick and advanced, often hospice care patients. But in feeding tubes for cats, especially with oral tumors, it allows you to bypass the mouth and that you can give them their nutrition. And a lot of these pets will do really, really well if we can manage their pain and their nutrition. So we definitely, desperately need new treatment options for cats with oral squamous cell carcinoma. You know, if it's just on the inside of the cheek, it would be, and it's small, I would be, you know, wondering if a board certified surgeon could do an aggressive surgery, but not a lot of great options for that cancer. How's everybody doing? Any questions on things that I've asked so far? I think we'll go maybe another question or two, and then I'll look for some questions in the comments as well. And then anything that I didn't get, we will just have to hop online. If anybody's still there and they want to tell me you're still with me, I would love a little shout out. Yes, Allison, feeding tubes can be so beneficial. Nutritional support is so important. And it's really just that sort of preconceived notion that we have about feeding tubes. I have had and the other thing, people think that they won't eat. They will eat on their own, even with the feeding tube. And if they're eating on their own, a lot of the times owners we can safely keep them in, and they can give them their medication, their pain medication, their anti-inflammatories right through the feeding tube, and not have to mess with a painful mouth. I can tell you, even pilling my cat when he had inflammatory bowel disease and lymphoma, he was a horrible cat to medicate. Wonderful cat, but horrible cat to medicate. And we struggled all the time. So having a way to bypass the mouth and get them their medications reliably and the right amounts can be really, really helpful. So let's see what other questions we have. What role does diet play in cancer? What would be one submerge? And then spay. Okay, I'm going to try to hit a few of these because they're great, great questions. So if I could only add one supplement to ward off cancer, asked Barbara. So Barbara, I assume you mean in a pet. Well, there's two questions. Is it a pet that's had cancer already and maybe has had like a low-grade mast cell tumor removed or a soft tissue sarcoma? What supplement would I use? And then the question is, are there any supplements that can really prevent cancer? So one of my favorite supplements that I use in my cancer patients is Apocaps, which is a non-prescription supplement, means you can get it online. It was actually developed by the co-author of my book. It was developed by Dr. Damian Dressler, and we co-wrote the Dog Cancer Survival Guide a couple of years ago. Actually, hopefully going to be working on a new edition soon. But they developed Apocaps, which I really think a good analogy is to think of it as like green tea for dogs. So Paul is saying for prevention, but let me just, I'll mention this one. So as Apocaps, if I have a dog that had like a low-grade mast cell tumor removed, or even my patients on chemo, I put them on Apocaps. It's a multi-supplement, so it has things like curcumin from the turmeric spice, and I think I saw a question about that in the comments. So it has that. It has luteolin, apigenin, some of the mushroom polysaccharides, and some gingerols. And so the benefit of that is it's all plant-derived supplements, and these plant compounds have been shown to help promote cancer cell suicide, which is called apoptosis. That's why they call the supplement Apocaps. And I find it to be very well tolerated. I use it with my patients after treatment and even during chemotherapy as well. So that's a really good supplement that I have on my shelf here and that I get most of my patients on. If your pet is on a steroid or a non-steroidal, you need to talk to your vet before you go on Apocaps, because they all have anti-inflammatory effects and can be irritating to the stomach. So if I have a dog that's on, say, Deramax or something, Rimadyl for arthritis, we will lower the Apocaps dose. But I use it with Palladian, all oral and injectable chemotherapy as well. In terms of warding off cancer, I don't know that I know that there's one perfect supplement for that. One of the supplements that Apocaps is spelled, we can put a link below afterwards, but APOCAPS, and there's a great website, and I'm pretty sure you can order it on Amazon as well. APOCAPS. They do also make a supplement, gosh, the name's escaping me at the moment, Everpup, and that is meant for pets that don't have cancer. It has some of the apopogens, which are these plant supplements, but it has other things as well, probiotics, prebiotics, and some other things. So if you have a pet that hasn't had cancer, Everpup would be the version of it that you could potentially put them on as a supplement. The other thing that I really like, and again, talk to your vet before you really add any supplement, but I also love the fish oils, the omega-3 fatty acids. There's a ton of health benefits. It's thought to maybe have some anti-cancer properties. It's really good for skin, really good for arthritis. So those are things that I like. Sort of some other supplements that I like and are very trendy in humans as well are probiotics. And this is not going to necessarily prevent cancer, but we do know that the gut health is so important to our body. So it used to be called the flora in our body. The microbiome is another term that they're using now. So I really, really like probiotics as well. And then the other thing, and this goes back to the question about diet, I think, healthy lifestyle for our pets. We know in people, some of the lifestyle things that can contribute to cancer are obesity and diets that are low in fruits and vegetables. So I think we need to be thinking about the quality of food that we're feeding our pets. Can we be supplementing them with vegetables and fruits and things like that? Because there's a lot of great compounds in our fruits and vegetables that can have anti-cancer properties. Some of those are in things like apicaps, but there's, there are studies, for example, so Scotties are at high risk for bladder cancer called transitional cell carcinoma. So there was a study a couple of years ago, and Scotties, which are this crazy high risk breed, they're 17 times more likely to get bladder cancer if they had vegetables in their diet, and it was more than 3 times a week. They actually had a lower incidence of bladder cancer. In that study, it was carrots. And, I often people say, oh, but carrots are so high in carbs and all carbs are bad. No, we need to look at where our carbs are coming from. So there's definitely good carbs in some of the foods. There's a lot of minerals in some of the carbs as well. So, I think it's important to look at where our grains are coming from. I like, GMO-free, grains and things like that. Caitlin just put a link to the Apicaps website, and like I said, you can get them on Amazon as well, so that would be good. Yeah, so again, I like omegas. I like, you can think about something like Everpup, which has some of the apogens and some of the prebiotics and things like that. I think omegas are good. And then again, thinking about diet, healthy lifestyle, exercise. I mean, we're learning in people as well all of the benefits of getting a lot of exercise for us and our pets and things like that. So there's definitely that mind connection as well. And that kind of leads to what I'll probably do as our last question is, what role does diet play in cancer? We could probably do a whole session on this one, but, there are studies, again, is there a correlation between certain diets? And, there is always this tendency to blame the foods, blame the diets on cancer. And I don't think it's that simple. I think, again, we need to look at where the foods come from. Can we use genetically modified organisms, the GMO, the corns and things like that? I try to make sure that they're not on those. The question comes is, there was a lot of press about, I always call the Atkins-like diet. So the low carb diets, are there of benefits? Dogs don't eat a lot of carbs, but all carbs are not bad. But the idea is that cancer cells require carbs as their energy source. So if we could shift them to a diet that's higher in fats and proteins, can it prevent cancer? We don't know that yet. And should they be on that once they have cancer? Fortunately, we don't have definitive studies that say it's going to make a difference. But if a client wants to home cook and do a well-balanced diet, I think that's the best. I'll be honest, and I just saw that my dad hopped on. Hi, Dad. I don't home cook for my family every day. So I'm never going to expect somebody to home cook for their dogs and their cats on a daily basis. If you want to, I can make, references on, going to a nutritionist and getting a home cooked diet. That's great. There's another great website called balanceit.com, and they can help you come up with a home diet plan as well. So that's another less expensive way than seeing a nutritionist. But, I think, looking at a home-cooked diet or even a therapeutic diet, a lot of these diets are more regulated and can be of benefit as well. But I'm not going to be the cancer specialist that's blaming dog food on it. But again, I think simple things that we can do just by adding fruits and vegetables, avoiding the dangerous ones, can be really beneficial as well. So Paula cooks. Paula, can you cook for me and my family as well? And my pets and my dogs? That would be great. No, I mean, it's great. I honestly think a home-cooked diet. But if you're home cooking, you obviously just can't be cooking some chicken and some vegetables. You really have to make sure that they're getting their vitamins and minerals. And so there are some veterinary now supplements that you can add to home-cooked diets to make sure that they're getting all the nutrients, all the vitamins, all the minerals that they need. If your pet, for example, has gastrointestinal upset, say they're going through chemotherapy and they have a little bit of diarrhea and their stomach's upset, I'm still going to do, I would love, home cooked chicken and rice, something nice and bland for a couple of days. That kind of, chicken and rice for a couple of days is not going to be detrimental to the pet's health long term. But again, if we're doing a home cooked diet, it's really got to be balanced by a nutritionist or one of these websites like Balance It, so we can make sure that we're getting all of their nutritional needs. All right, so I've been babbling on for about 30 minutes, and I appreciate everybody's time. And I believe it or not, I got to get back to work at some point today. So I hope that that was helpful. I'm super excited. If you guys like this, throw something in the comments. Even if you're watching the replay, throw a comment in there. And if you guys like this, I will do this again another day. The other thing, if you guys would be really, really helpful, and maybe we can do a poll. Let's try to do that. Maybe we'll do a poll tonight or tomorrow. I would love to know what day and what time is good. And I know we're going to get things all over, but we can do one in the evening if that might be helpful for people. And we could also do them during the day. We could, try that because I definitely want as many people to see these as possible. Before we go off, bear with me. I'm going to kind of scroll through and see. I love you too. I love the love. Turmeric, yeah, that, that I kind of talked about that. There's definitely been some good studies about turmeric and curcumin with its anti-cancer properties. So that's also included in Apocaps, but you can supplement that alone as well, just getting that from a health food store. Chloramphenicol, 4 days Palladia. So Karen has a more specific question about her dog with an aggressive tumor on his heart. That's going to be a harder one to answer online, more specific individual pet question. Karen, another option that I'll have for you, and this is another option if maybe you have another specific question. Another way that I can answer questions is I do a podcast with Tracy Hotchner called The Pet Cancer Vet, and that's when we have you call in and you tell us a little bit about your pet, and we can make some, more specific but still general recommendations. So Karen, I would, it's radiopetLady@gmail.com. We can put that in the comments as well. Caitlin, maybe we can throw that in the comments. And so if you're interested, I would love to have you on the podcast, and maybe we could answer the questions about that as well. And so we talked about feeding tubes, a little bit more about turmeric from Marion. Yeah, so I don't know about this golden paste, but I will have to do some homework and look into that. And so then the other question that I guess we can even talk about, the next one is about cannabis. And so I actually just got back from a great set of lectures about cannabis and some of the parts of the marijuana plant, and the little preview we can talk about. So it looks like there can help with anxiety, with pain in pediatrics. Kids with cancer, sometimes they can use it and lower other pain medications that are less that can be more addictive. So they can use it for pain and also for its appetite stimulant. I don't use a lot of it at this point, but it's definitely something I'm starting to incorporate more into my practice. They can be a little bit pricey, but it is another good option as well. All right, guys. You made it. Thank you so much for joining me. Again, I'm not sitting outside. I'm sitting in my exam room at my beautiful new practice, but it does look like I'm sitting outside with a very, with a very large basset behind me watching over me. So it's a great place. I'm at the Veterinary Cancer Center. If you're in the Metro New York area and you have sadly a dog or a cat with cancer, I'd be happy to see anybody in person, or if you just want to pop in and say hello, that would be awesome. So thanks everybody for joining. Is anyone still with me? Did we find that useful, fun, good? Anybody? My son is texting me as we speak, so it must be time to go. Anyway, everybody, thank you so much. I really, really appreciate, oh, this is my fault. Oh, thank you. Caitlin put the link for our podcast. And everybody, Karen, Diva, Donna, everybody, super, super excited. Caitlin, maybe we can get a poll and we can find out what time and day, and we can try to, and I'm okay if there are different times. We can definitely just, jump on and do this at different times. And the cool thing is you can always go back to the replay and watch it there as well. All right. Thanks, guys. Kick cancer butt. And definitely make sure Ruby goes to the vet and get that aspirate done, and then let us know what we find. We're hoping for something benign. But again, just I'm going to end with this. So most skin and subcutaneous, can't speak at the end of the day. Most skin and subcutaneous tumors, so tumors under the skin, can be cured with surgery alone if we find them when they are small, even those malignant ones. So let's find them when they're small. Pea size is like the perfect size. So again, if the mass is the size of a pea and been there a month, go to your vet and get an aspirate. Thanks, guys. You all rock. Let's kick cancer's butt, and we'll do this again soon. Take care.